Westridge Obstetrics and Gynecology is a group of doctors and nurse practitioners. We treat patients of all ages from their teenage years into menopause, and we do general gynecology, general obstetrics, as well as high-risk obstetrics, and we treat all kinds of gynecologic problems from abnormal bleeding to infertility to problems such as pelvic prolapse and urinary incontinence.
As managing partner of Westridge OBGYN, the largest OBGYN practice in Rochester, we can afford to have different physicians specialized in different areas of gynecology and gynecologic surgery. Westridge OBGYN is fortunate to have 5 robotically trained GYN surgeons, often working together to meet the needs of our individual patients.
Almost any surgical procedure that would ordinarily be performed using a traditional laparotomy can be performed using the robotic laparoscopic platform. Specifically in gynecology, we provide hysterectomy, myomectomy, adnexal surgery, infertility surgery, as well as pelvic support surgery.
The robotic surgery is a sophisticated robotic platform that widens the surgeon's capability in robotic or minimally invasive surgery. We put small incisions in the patient's abdomen where we insert the instruments and a high-definition camera. The surgeon then sits in a console where he sees a 3D high-definition, high-resolution image of the surgical site. And then the hand movements of the surgeon is manifested as precise movements in the robotic instrument arms.
The delicate size enables us to maneuver and manipulate the scissors much more easily than we would ever be able to using traditional surgical instruments and the human hand. There are many benefits to using the Da Vinci laparoscopic surgical platform. From the surgeon's perspective, it enables visualization of the surgical field that ordinarily would not be possible. Using the platform, we can see the field in a 3-dimensional, high-definition format that would not be possible without using the robot. Also, increased manipulation and dexterity allows surgical procedures that were previously impossible to now be performed using a minimally invasive approach.
For the patient will have a shorter hospital stay, less pain, faster recovery, less blood loss, therefore less blood transfusion. The patient will also be able to return faster to her daily activities.
Globally, Westridge OBGYN is at the forefront in GYN robotic laparoscopy. The American Association of GYN Laparoscopists is an international society of experts in GYN laparoscopic care. They meet every year at a scientific congress to present the best work in GYN laparoscopy. Westridge OBGYN has submitted and had accepted and presented 9 surgical teaching abstracts at the American Association of GYN Laparoscopists. Locally at Rochester General Hospital, Dr. Mark Greenstein, one of the partners at Westridge OBGYN, is Director of Minimally Invasive GYN Laparoscopy. He's also getting the hospital certified to be a center of excellence in a newly created program with the American Association of GYN Laparoscopists.
A patient who is needing a hysterectomy or other major gynecology surgery may qualify for the Da Vinci robotic surgery. In order to find out, they can speak to one of our doctors and discuss their medical conditions, their options, and find out if they are qualified for this type of surgery.
I had the Da Vinci robotic surgery done, and Dr. Dreyer performed my surgery. The recovery time after my surgery was only 3 weeks. I was able to go back 3 weeks to the date when I had the surgery and then work out 4 weeks later with no restrictions.
Besides having a great pre-op and post-operative care group at Rochester General Hospital, we also have friends in general surgery, urology, and colorectal surgery to help us with more challenging situations that may arise. They're always available to us, and often we will actually schedule surgeries together when the patient's complex situations require multiple specialties to achieve an excellent outcome. With that said, colorectal surgery and urology have physicians who are trained in robotic surgery that are second to none in the country.
Robotic surgery not only revolutionizes the way surgery is able to be performed, but also revolutionizes the way people are able to heal. Patients who undergo robotic surgery can expect a much quicker return to their normal lifestyles. They will be able to return to the gym, to their running group, to their exercise classes, whatever activity they enjoy being involved in, much quicker than with traditional surgical techniques.
I would like to speak for a moment regarding the Da Vinci robotic platform and pelvic reconstructive surgery and urogynecology. In the early 1990s, when I was in training, the gold standard procedure for pelvic organ prolapse was a large vertical midline incision with a 7 to 10 day hospital stay and a long painful recovery at home and a prolonged recovery to get back to normal work. Now, using the Da Vinci robotic platform, the minimal invasive nature of the procedure, the small incisions, and the usual less than 24 hours in the hospital results in a more rapid, complete recovery, much less pain, and patients returning to work in a more complete fashion.
Robotic surgery really is the wave of the future. There are many robots in many hospitals throughout the country being used on a daily basis already. And with time, each day, many more robots are being added to other hospitals throughout the country. It really does revolutionize the way surgery is able to be performed. It allows us many more surgical options than even with traditional laparoscopy.